Okay, so hi guys. My name's Adrian Richards. I'm a plastic surgeon, and I'm delighted to introduce the star that is.
Oh, hello. My name's Erin, and I had a minimally invasive breast enhancement procedure about 9 months ago now. And I'm sort of really pleased to be able to come here and just talk about my experience to give like insider information in terms of getting to the point of deciding I wanted that sort of procedure, all the way through the procedure itself, my recovery, and actually just how I'm feeling 9 months on about it all.
Brilliant, brilliant. So you talked on the Instagram Live a little bit about why you're a mother of two. I know you've got a very busy job. You know, why did you choose this procedure?
So I had always wanted bigger breasts since as long as I can remember, late teens. But I'd always been put off by the surgery itself, the downtime, the scarring, the stigma around the results that you may get, as I'd only really wanted a natural boost to what I'd already had. I'm generally petite and I didn't want huge boobs that looked fake, and that was sort of the stigma of traditional breast enhancements at the time. And then when I had previously inquired about breast surgery, I was sort of advised to maybe wait until after I'd had children, as your breasts can change. So, flash forward 10 years or so, I'd had my kids, and I sort of decided that now was a time that I wanted to have a procedure done. And when I first made that decision, I did start to look down the traditional route again, and I stumbled across Mia, minimally invasive procedure technique, where the implant goes through the armpit. And to me, it just sort of answered all of the concerns I had with a traditional procedure, because it was something that didn't leave scars on my breast. There was minimal downtime. There wasn't a general anesthetic, which was a big factor as well. And I decided to proceed with that procedure 9 months ago, and I've sort of gone from a B, really small B, to maybe a C, small D cup, and I really couldn't be happier with the results.
How does it change the way you feel, with clothes and sport and exercise compared to how you were, Erin?
So it's amazing that something that I don't show anyone else really has such a profound impact on just the way I am, the way I feel, my confidence. And I think if you are somebody with small boobs, it's really easy to relate to that sort of consciousness that you often get when you are wearing clothes, when you are wearing a bikini, the outfit choices that you potentially feel you don't have, and it's quite limiting. One of the big things that I covered in one of my TikTok posts that I done a few months ago when I went on holiday was, my ability to wear a strapless top. Like, that was something I'd never considered doing before, because, strapless tops have excess material around the bust to hold your boobs in. And, if you don't have boobs, there's nothing to hold up that strapless top, and it just is all really gapey. And, after having the procedure, such a small thing like that nobody else would have noticed, really gave me a air of confidence I hadn't had before. And just being able to, feel confident and comfortable in my own skin, in my own clothes. And for other people as well, they can really see a change. And cherry on top of the cake is I look at myself, without clothes on, without a bra on, and there is nothing that would indicate that I've had a procedure done, because where the incision was right up in my armpit and it's healed so well, when my arms are down, or even when they're up, really, you can't see that I've had anything done. And to anybody else, it would just look natural and normal and natural. Yeah.
Yeah, well, that's great. So, just like thanks, Erin. I'd just like to introduce Ali. Hi, Ali.
Hi everyone. Hope everyone's having a good evening.
Yeah, tell us about yourself, Ali.
So I'm a consultant plastic surgeon that specializes in both cosmetic breast and breast cancer. And that's my main focus. And my real interest is in tissue preserving techniques that are minimally invasive, that provide really beautiful natural results, with minimal scarring and inflammation.
Okay, thanks, Ali. So, what we're going to do is just really quickly just show you, just try and explain what tissue preservation is and why it's different from other techniques. So, iQonic is a company which was set up in the summer of last year, and it's similar to things that we've done before. and it is essentially a group of 5 plastic surgeons, one of which is Ali, of different ages, different skill sets, but all very collegiate, who work together. Surgeons who specialize in the face, you specialize in the breast, particularly Ali, but we have a whole range of 5 different surgeons, and our ethos is really to treat you as well as we possibly can, because we're plastic surgeons and that's what we do. And our focus is on the 3 Ps, as we always say. What are they, Ali? The 3 Ps? Ali?
So they are our patients, the people around us, and obviously the planet.
So the planet is, you're just looking after people and working together. So that is what iQonic is. Can we hear about a little bit about next slide, please? Yeah. And Erin, do you want to talk a little bit about these things? You on the TV and everything?
Yeah, so at the time I'd sort of stumbled upon my minimally invasive procedure. It was actually through coming to iQonic and speaking about a traditional procedure. And from speaking with the team at the time, and I detailed really what I was after and my concerns, they'd suggested this new technique that was coming. Well, it wasn't yet being done in the UK, but I could be, amongst the first people to have it done, which meant there wasn't a huge amount of information available for me to, conduct my own research, watch videos, go on YouTube, TikTok, all of that sort of stuff to get an idea of what it was about. It didn't put me off having the procedure done, because from the conversations I'd had and the information I could find, it still sounded like the absolute perfect answer for me. But that made me want to, document my journey, so anybody else that was embarking on sort of the procedure like I did would have information available to them. So I sort of started right at the beginning, went through my first consultation and just started sort of going through all of the key points and milestones that somebody considering it may want to find out more information about. And those videos done really well. And
how many viewers have you had, Erin? You've had thousands of people watching them, haven't you?
Yeah, so within the last month and a half, nearly sort of 8,000 plus views on my YouTube videos, over 120,000 views on my TikTok videos. But views aside, it's actually the comments and the questions and the engagement that I get is what's really important for me, because I get women, ladies, people exactly like me in my same position asking me the questions that I wish I was able to ask. And I'm sort of so invested in everybody's journey, because it is, it's groundbreaking to be able to, have an enhancement like this and not to have, the downtime, the general anesthetic, the scarring, all of those things that, is a worry, to have them not be a problem. So it's been brilliant. So I've loved sharing my journey, and along the way we've been able to do like Q&As, we've got on the telly, we've done like,
Erin, that was you on the TV, wasn't it, when on the one on the left?
Yeah, and that was less than 2 weeks after having it done.
That's right. So you came on the TV. It was nice to meet. It was a good day, wasn't it, meeting Josie and Ryland?
It was brilliant. Everyone was so interested in it. And I think that's one of the main things is, you say to somebody a minimally invasive procedure, or, a balloon, or we're going to pump it up or something like that. And everyone sort of goes wild, wondering what that means.
Erin, do you mind explaining, this is you before and after?
Yeah.
Talk us through how you felt.
So I'm sort of, I think the pictures speak for themselves, really. I didn't have, huge breasts. After my 2 children, they lost any volume that they did have. I'd always been small, but then I sort of was just skin with nothing underneath. And I sort of do quite a lot of exercise. I've got quite strong pec muscles, and I felt that, that is what was prominent more than anything else.
If you look at your picture, I think Ali would agree. You can see you work out from those before pictures, because you've got pretty strong pecs. Would you agree, Ali?
Yeah, absolutely, definitely.
Yeah. So what change in size have you gone, and have you had to change clothes, Erin?
So I think just pointing out those after pictures were only 6 weeks after that. So actually the what I look like now is slightly different to that. They've dropped a lot more. They probably appear softer than they do in those pictures. So for anybody watching, you know, that isn't the absolute end results. It takes several months for you to get that, you know, end journey in
The
terms
more
of
natural upper pole, yeah.
yeah, absolutely. But in terms of clothes, you know, being able to, you know, not necessarily feel like I always need to wear a bra, because often I was wearing a bra to give myself the shape that I didn't have. And that is like a really big thing. That we've touched on already, the ability to wear certain types of clothes, and actually just feeling confident in myself to, you know, be able to walk around, you know, my own house, not feeling sort of like conscious of how I look, you know, in front of my husband, or all of those sort of things. It's a very personal thing, and I'm sure to anybody else they wouldn't sort of see my before photos as anything other than great. You know, they're relatively symmetrical and all stuff like that, which is fine. But for me, I just wasn't happy, and I wanted to do something. And you know, now I feel like I've got the breasts that I always should have had, and they suit my body perfectly. They're not too big, they're not too small. To anybody else, they wouldn't look at me specifically and think I'd had something done, which is the main thing for me.
Yeah. Okay, Erin. So now we're just going to explain a little bit about Ali. Do you want to do this bit? What is tissue preservation? We've got a slide for you, Ali. So,
Okay, let's have a
so
look.
we're going to explain what it is, why is it better, and how is it done. So do you want to have a go at that, Ali?
Yeah, sure. So we have two techniques at the minute that is really the paramount of tissue preservation. The one that Erin has been talking about, which is Mia. And then the newer one that's very similar, uses the same, you know, precision engineered instruments to Mia, which is Preservé. And the theory behind them is, instead of cutting through the muscle, the breast tissue, the nerves, the vessels in a traditional breast augmentation or enhancement, this new technique gently stretches the tissue and pushes it aside to create a space for the implant. And by doing so, it reduces the trauma that the tissue has, so the trauma on the breast tissue, and then reduces the inflammation. So then improves the recovery. There's a lot of less post-operative discomfort. You return back to work quicker. There's minimal disruption to the natural tissue.
The essential thing about tissue preservation is, as it says, your tissue is preserved. So in the old way that we've done it, breast augmentation, because we need to create a cavity for the breast implant to go into. So what we would have traditionally done is cut and cauterize, which is basically heat the tissue to make the cavity. And we didn't know exactly how big to make the cavity. But cutting and burning tissue causes pain afterwards. So we would do it to the size, then we would insert the implant by a long scar. So some of the scars that I used to use, if I see a patient I operated on 20 years ago, have scars 5 or 6 centimeters. Now we use 2.5 centimeter scars. What we do now, so Ali, if we show, Adam, can you just show the expansion? So now, instead of cutting the tissue, what we do is we insert a balloon, a deflated balloon, through a very small incision, and then we can gently inflate the balloon, as Adam's going to show us, which pushes the tissue aside. So the tissue is your nerves, your blood vessels. So none of the tissues are damaged. So you'll still have sensation, you still have good function. And because the tissue hasn't been cut or divided, you have a quick recovery. So that, in essence, is minimally invasive access enlargement. And there are 2 ways currently of doing it. Mia, if you are more symmetrical through the armpit and you would like a maximum 195 cc implant. If you would like to go slightly larger, or you're asymmetrical, what's the better technique, Ali?
Then Preservé. I would use a small cut, probably about 2 centimeters to 2.5 centimeters underneath the breast.
Okay, so hopefully we've explained that. So now we get back on the screen, so it's just the 3 of us. So Erin, your go.
So I think for me, you know, if you've ever sort of considered having a procedure, now is the time, you know, with these new techniques, the ability to have, you know, the same sort of an enhancement that you could have before, but without the sort of big scar, without the downtime, without the general anesthetic, all of those things. And when I had my procedure done, I did only want, you know, a small implant. And actually I had a 170cc, which is a middle of the road implant, which suited my body perfectly. But I know from speaking to a lot of people that are considering the procedure I had, they just want a bigger implant, which wasn't available through Mia. So if you're somebody that is after a bigger implant, that's the look that you want, then this new technique is going to answer your questions with, you know, all the same amazing benefits that were found with Mia.
Ali's answering some questions there, Ali. So we've got, does the Joy Doc minimally invasive procedure use the same technique? Well, it's slightly different. Okay, so it's a bit confusing. Okay, so Mia, a small implant, diamond shaped, inserted via a 2.5 centimeter incision in the armpit. Okay, because they're diamond shape, although the maximum size is 195, they appear about 25% larger. Okay, really good if you would like a very natural enlargement and prefer not to have a scar on the body. The Preservé technique, it basically inserts a Motiva Ergonomics 2 implant, which is the latest ergonomics implant, via a funnel via the inflammatory crease, which is the fold underneath your breast. Actually, I mean, plastic surgeons do talk in quite complicated language. What we normally would do is see you, and Erin's going to talk about her process now, but so normally we would see you either virtually or in person. We would measure you, take photographs, discuss the options with you. Then we try implants on you and we do a reconstruction. So we try implants so that you can see how they feel on you. Then we do a 3D reconstruction to show you how you would look with clothes and moving. Then you go away and we'd like you to have a think about things. We always see you twice, so you can choose to try the implants again. We like you to come with somebody, try the implants in your own clothes. And then you have the procedure, which is a day case. You're in the hospital about an hour before the operation, an hour after the operation, and about 2 hours afterwards. And the hospital's in central London. Erin, is that how the process was for you?
Yeah, so when I first found out about Mia and I was looking at, I did use the online software that you guys have available through Adorial. So I actually submitted, you know, my own photos. I think it's a Chrysalax platform, something like that.
Chrysalax.
That's it, Chrysalax.
Yeah.
So I took some photos of myself, like a selfie, and then I got to sort of choose to see images with myself having a 1 cup, 2 cup, 3 cup increase. And it was from there I was able to, you know, really think about how I might look. So when I entered my first appointment with Adrian and the team, I had an idea and they had an idea, the sort of look I was going for. And then I sort of had all the measurements done, got told I had lovely symmetrical breasts and that I was a perfect candidate for Mia, which was exactly what I wanted to hear.
So her measure, so Erin's, so we take very detailed measurements, don't we, Ali? So why was Erin, you know, because she had the golden triangle. Can you explain that, Ali?
Yeah, so the principle behind this golden triangle is a bit historic from the 1970s, but that everyone is meant to be symmetrical. No one is, and they're sisters rather than twins. But the numbers that you're looking for is 21, 21, and 21, and that's really from this little bone here called the sternal notch, and it goes down towards the nipple, and then it's the nipple to nipple distance. And ideally, in theory, that if someone's symmetrical, then you'll have a golden triangle. But a few people are, some people aren't, which is not a big deal, but we just have to be selective.
So the golden triangle is something that we're quite interested in plastic surgeons, and Leonardo da Vinci wrote about it and drew pictures. You know, when those pictures of the faces, when you draw a face, you often draw in triangle, your cheekbones and your mouth is a triangle. So Leonardo realized that triangles have beauty, and it's the same with the breast. So the distance the limb should be the same. So when we analysed Erin's photos, she was very nearly had those dimensions.
And then following those measurements, I got to do the fun bit and try on the implants. And actually, that is a weirdly scary process, actually, because when you're putting these implants on and you're sort of imagining yourself with these breasts that you've never had before, but you've imagined, it all starts to feel very real. And then I went through that, you know, phase of, oh no, these are going to be too big, these are going to be too small, oh no, that's way too big. And I took lots of photos of myself with the implants. I took some clothes with me. I took a bikini top, and I tried the implants in and then took some photos. So when I went away, I was able to, you know, reflect on the images and really see how I looked in clothes that I sort of was comfortable in. And then I sort of decided I wanted to proceed with the procedure. And, you know, when my appointment, my procedure date came round, I had a wonderful experience going to the hospital in Preservé in central London. And from there, really, it's where it sort of got a little bit more serious, because obviously it is still a procedure and there are risks. And I had to go through all of those considerations and then be measured and sort of go through that whole process. But it was very chill, to be honest, because I was so desperately excited. It's something that I'd really been looking forward to for such a long time in sort of one form or another. But where it wasn't a general anaesthetic, I sort of walked myself down to the theatre. I got myself on the bed, and I was given, as you know, as standard with these sort of minimally invasive procedures, a sedative. So whilst I could feel some tugging and some movement, I had no pain at all. It wasn't uncomfortable. I was sort of chatting away to the nurses, asking lots of questions and sort of just really finding the whole thing fascinating. And as I said right at the start, it only took about 45 minutes or so for it to be done. And then, you know, the screen came down. I was able to get a first glimpse of my eagerly anticipated boobs. It was amazing. And then I spent about half an hour or so in recovery, and then I went back up to my room, and I probably left the hospital a couple of hours after that, and then came home and tended to my children. But you know, the first night, and I think this is a question that I get asked a lot by people that follow on my channels, is what's the recovery like? How painful was it the first night? And you know, I don't want to gloss over the fact that there is some pain, there is some discomfort once, you know, the paracetamol and all of that sort of stuff wears off. But comparatively to what you'd be expecting from a traditional procedure, like it's very little discomfort. And
Erin, now 9 months later, so a year ago this time it was before.
Yeah.
Does it feel heavier? Do your shoulders feel heavier? Does your posture feel different? Does it feel different at the gym?
No, not at all. If anything, I would say that I walk taller with my shoulders back. You know, it's that sort of confidence that it gives me, having this sort of procedure. And as I said right at the start, it's sometimes the littlest things that people wouldn't consider make the biggest difference. And you know, for me, wearing a big jumper and a coat, I'm still walking around more confident because I feel more confident.
And Erin, has anyone noticed, Erin?
I don't think I would have ever walked past anybody and they've gone, you've had breast surgery done. What I do get is, oh, your boobs look good. You know, those sort of comments, which is amazing. But no, I don't think anybody would look and think I've had a procedure done. I just look like I've got breasts that suit my body.
Okay, I'm going to ask you some questions. Hallie, we're going to ask quick fire questions to Erin. Have you had to change your wardrobe?
Only in a positive way, not hugely, because I only went up a couple of cup sizes, and actually now I just fit my clothes better. So I wouldn't say I've had to buy new things apart from some new bras, but that's just true.
What size have you gone from to?
So I currently am buying now I think it's a 32D, I think. But you know, it depends what shape of bra you get and what shop you buy it from. So varying between a 32C or a 32D.
Do you go off when you go through the security at airports?
No, I haven't had that yet, but people did joke about it because there is a little Mia chip inside my breast which you can use when you're checking them.
Yeah. Can you do yoga, Pilates, and all weighty exercises?
Absolutely, it hasn't impacted me doing anything at all. And again, a question I get asked a lot. I do a lot of weights and training, running, jumping, that sort of stuff. And once the first couple of months have passed, it's really no different. I just have to wear a slightly more supportive sports bra, but that's not a negative thing.
Okay, I'm going to ask you some more questions. How long do your implants last for, Erin?
So they last forever unless there is a problem. Again, a misconception that people think you have to change them every 10 years. That was something that I certainly thought was the case, and possibly more sort of historical implants. But these ones, I'm sort of led to believe that as long as I'm happy with them and they're happy with me, then we'll last forever.
How do we check on them, Erin?
Oh, you scan them.
Yes. Well, how do we, Ali, you're the ultrasound expert. What do we do?
Yeah, so we have this little device on handheld ultrasound. Some people might have, when pregnancy, used it on their tummies to look at the babies. We use it in our clinic to look at the implants to make sure that they're all healthy. We look for certain things, the implant shell, to make sure that's all fine, look for fluid around it. But it takes about 15 minutes, handheld device, fairly accurate, and then we can take it from there.
Yeah.
I have a question for Erin. Have you noticed any changes in sensation or numbness or anything like that? That's a very common question that I get.
No, I haven't. I sort of have had kids and all that sort of stuff, and your breasts have changed so much over that time in relation to how they feel and all stuff like that. But directly relating to things post this procedure, no, nothing has really changed. They really just feel like they're sort of part of me now.
Okay, another one. Can you have mammograms?
Yes.
Yes.
Why, Erin?
Well, you should, and everybody watching this should be having their mammograms anyway. But you'll have to correct me as the experts, but it's something to do with the material of them. It's suitable.
It's because the implants are behind the breast tissue. The breast tissue is pushed forward, so you can still examine yourself and have mammograms as normal. But Ali, you're the breast expert. Do you want to explain a bit more about that?
Yeah, so I agree with Aaron 100%. You should definitely be self-examining after the breast implants, knowing what your breasts feel like. But yeah, you can definitely have mammograms as normal in the UK. You'll get an invite between the age of 50 to 70. And what they do is called the displacement technique. So they'll pull the breast tissue forward and then they do the mammogram while the implant's pushed backwards towards your chest. But yeah, it does not affect your mammograms. You do have to doing it, they have implants, so they can adjust their techniques. Yeah, as normal.
Okay. Yeah. Well, guys, we've had millions,
And one
loads
of the questions that we had here,
yeah.
one of the other questions we had here, is it above the muscle or below the muscle?
Yeah.
Mia goes above the muscle, and so does Preservé. That's usually how we do it. Can you do a lift at the same time? Yes.
Yeah.
When we do a lift, we kind of do two procedures.
Oh, okay.
We do the augmentation or enhancement first, and that's the normal Preservé.
Brilliant. Okay, so thanks, Ali. So I think we've run out of time, unfortunately. So Erin, I know we could talk forever, and Ali, so we're going to be doing more of these if you think they're helpful, to talk about implants, different types of implants, under or over the muscle, all your different options. And of course, at iQonic, we do the full range of surgery, everything from the top of your head to the bottom of your toes. We have specialists in facial surgery, really good Bruker surgeons. So thanks for joining us. It'd be great if you could see Erin's journey in the chat and TikTok. How do they do that, Erin? How do they?
So you can find me on YouTube. You can just search my name, Erin Alexander, and also on TikTok as well. So on my TikTok, I done a daily diary for the first month or so, and then heated off into every couple of weeks and then every month. So you get a full, a 9-month journey through my Mia experience, and then slightly longer videos on YouTube, actually documenting my procedure day, my week 1 recovery, and and a Q&A that we done at the time of my 6-week check as well.
People can ask you questions, can't they?
Absolutely. I'm always happy to answer the questions.
Yeah, brilliant. Ali, anything before we go? Thanks, Erin. Ali,
It
anything
was
before we go?
lovely having everyone with us today, and hopefully you've enjoyed it and it was educational. And if you want a consultation, I'll put the link below in the comments. You can book and schedule a consultation.
Are interested in learning more, please book a consultation. We can either see you virtually. We have a lot of patients from around the world, so if it's most convenient, we can just schedule a time for you to meet myself or Ali or one of the other surgeons virtually, or you can come and see us in London. We also have a surgeon in Manchester, Professor Dr, who's absolutely lovely person, specialised in plastic surgery all over the body. So whatever type of plastic surgery you're interested in, please contact us. Ali, how have we selected the iConic surgeons?
Well, I think you've hand selected all the surgeons with, different people with different backgrounds, different experiences, as you said,
Yes.
with different subspecialties.
Yes.
But
So
we work together really well. We're all part of a big family.
Yes, we're all part of a big. So basically, if we work together, plastic surgeons as a big family, like as a group, like we were trained to do, we can create much better environments and really lead the way in plastic surgery in the UK. And Erin, thank you for helping us do that.
Thank you
Thank
so
you, Erin.
much, everybody. As we've said, any questions, please, I'd love to hear everyone's journey and help anybody out if they're feeling unsure.
Big thank you to the team and to Ali and to Erin. So good night. See you soon, guys. Bye.
Bye.